You know that horrible feeling like there's a grain of sand stuck in your eye and you just can't get it out? Well, there's a good chance you've actually had what's called a corneal abrasion. So today we're going to break down exactly what that is, and we're using a comprehensive medical guide to do it.
Okay, so looking at a medical fact sheet like this, yeah, it can look a little dense, a little intimidating, but trust me, everything we need to understand this really common and, let's be honest, really painful eye injury is right in here. So let's unpack it.
Here's how we're going to tackle this. First, we'll figure out what a corneal abrasion actually is. Then we'll get into the causes and symptoms, how they happen and what they feel like. After that, we'll look at how a doctor diagnoses it, what the healing process is like, and finally, what you can expect during recovery.
All right, first things first, what exactly is a corneal abrasion? When you boil it all down, it's just a fancy term for a scratch or a scrape on your cornea. And your cornea is that clear, protective layer right on the very front of your eye. A great way to think about it is like getting a scratch on a camera lens. It messes with the surface that's supposed to be perfectly smooth and clear. Okay, so it's a scratch. Simple enough. But how do you get one? And maybe more importantly, how do you know if you have one? What does it actually feel like?
Well, the causes can be, just about anything from everyday life. It could be something poking you in the eye, like a tree branch when you're doing yard work, or a piece of sand or dust getting in there. Even something as simple as a contact lens that's not sitting right can cause it. And yeah, sometimes you have no idea how it happened, which is super frustrating.
Oh, you will definitely know if you have one. The pain can be intense, and there's a reason for that. Your cornea has one of the highest concentrations of nerve endings in your entire body. So you're going to feel that sharp pain, especially when you blink. You'll get that classic gritty feeling like something's stuck in there, plus a lot of redness and tearing. And since the cornea's job is to focus light, you'll probably also notice your vision getting blurry, and wow, you will not want to look at anything bright.
So, you've got these symptoms and you go to the doctor. What happens next? How do they know for sure that it's a corneal abrasion? Well, the diagnostic process is actually pretty cool and super precise. First, they'll use something called a slit lamp. It's basically a big microscope that lets them get a really magnified view of your eye. But here's the really clever part. They put a special yellow-orange dye in your eye. It's called fluorescein. Then, they shine a blue light, and anywhere there's a scratch, the dye pools in it and glows bright green. It's amazing. It perfectly highlights the exact size and shape of the injury. Of course, they'll also check your vision and make sure there isn't any deeper damage. All right, so now that it's diagnosed, how do we fix it? What's really interesting here is that the treatment is kind of a two-pronged attack. It's not just about medication. So on one side, you have treatments that are all about protecting the eye and making you comfortable. That might mean things like warm compresses or even a special kind of contact lens that acts like a bandage. And it's funny, the classic pirate eye patch, it's actually pretty controversial now and not used as much. Then on the other side, you've got the medication. This is absolutely crucial. You'll get antibiotic drops to prevent any nasty infections from setting in, and maybe some other drops to help with that serious pain. Now, there is a huge, and I mean huge, warning in the guide about one specific treatment. The doctor might use some numbing drops in the office so they can examine your eye without you being in agony. But, and this is so important, you should never be given those drops to take home. Why? Because while they feel good for a minute, they can actually stop the cornea from healing and could cause really serious, permanent damage. It's a massive no. Okay, let's talk about recovery. And this is where the really good news comes in. Your cornea is an absolute superstar when it comes to healing. In fact, it's one of the fastest healing parts of your entire body. So relief is usually not that far away. For most simple scratches, we're talking about a full recovery in just 2 to 3 days. That's it. Your body is just that good at rebuilding that top layer of the cornea. But here's the thing. Because it's supposed to heal so quickly, if it's not getting better, that's a big red flag. It means something else might be going on, so a follow-up is absolutely key. And that follow-up needs to be quick. The rule of thumb is pretty simple. If you don't feel any improvement within 24 hours, you need to get reevaluated. That is the single most important safety net to make sure everything is healing the way it should. So when you pull it all together, what's the big takeaway here? It's this: don't mess around with your eyes. That pain, that redness, that gritty feeling, that's your body screaming that something is wrong. So what's the first thing you should do? It's simple. Don't wait. Go get it checked out by a professional. Period.